Good evening, everyone. Am I audible? Am I audible, guys? So, good evening, all. So, welcome to discussion of INICET PYQ series. So, as you know, in INICET, there will be at least 9 to 10 questions from forensic medicine. Yes, Madhusudan, Abhinay Reddy, Dhananjay, Srinivas, Vinay MR. Good evening, all. Good evening. See, INICET is one of the most difficult exam. So there will be at least 9 to 10 MCQ from forensic medicine. Most of the questions are usually from the proper forensic medicine concepts and toxicology. So usually ethyl alcohol, opium poison, paracetamol poison, arsenic poison, lead poison, very commonly asked. Snakes, one very important topic. So Aishwarya Baligar. Yes. So let's start. Srinivas, Abhinay Reddy, Madhusudan. Shall we start? Audio video, is it clear? Is it clear, guys? Audio video? Yes. So let's start. So INICET previous year questions. Basically 25 and 24 papers and the discussion of only those questions. Okay, around 1.5 hours maximum. So the first question. So this is asked in INICET 2025. So I discussed many times in my classes. Grievous hurt, that is basically 116 BNS, very commonly asked. So grievous hurt means very serious hurt. We call it as like fracture, like example emasculation, permanent loss of privation of either eye, vision, that is all, right? So the question is, which of the following is not grievous hurt as per 116 BNS? Options are elbow dislocation. So dislocation of any joint, definitely a grievous hurt. Emasculation, that is also grievous hurt. As you know, emasculation applicable only to males. Example, castration, cutting of penis, damage to lumbar spine leading to impotency. Fracture or dislocation of teeth, so that is also grievous hurt. Severe bodily pain for about 15 days is grievous hurt. So here it is given 5 days. So it is false. Very simple it is. 116 BNS states that severe bodily pain or the act endangering life or inability to do ordinary pursuit for about 15 days amounts to grievous hurt. So B is the answer. So very good, many answered. So the first to answer, Madhusudan. Okay, Madhusudan is first to answer. Great. Let's see. As I said, 116 BNS, just try to remember gore, agat, karna. Okay, gore, agat, karna. That is basically serious, severe injury. So there are basically 8 clauses. So what are 8 clauses? You can see here: emasculation, permanent privation of sight of either eye, permanent privation of hearing of either ear, privation of any member or joint. Like example, member means any part of the body which has specific function. Like example, thumb has a specific function, limb has a specific function, ear has a specific function. So that is member. Or destruction of power. Like example, bone contracture, wrist drop, foot drop due to injury. Permanent disfiguration of head or face. Like example, vitriolage. So we have section 124 basically for vitriolage. So even any abrasion over the face or any scar formation over the face can lead to grievous hurt. Fracture, dislocation of bone or tooth. Then act endangers life. Severe bodily pain for about 15 days. So this is very commonly asked. So all of you write in the chat box, 116 BNS is equal to 15 days. So previously it was 20 days, now it is 15. So keep writing guys. So Dhananjay, Srinivas, so that's really nice. Now some more important BNS. What is hurt? That comes under 114. This can be MCQ in upcoming INI CET. Voluntarily causing hurt, 115. So previously it was 323, 325 and all. Now it is 115. 116 grievous hurt. 117 voluntarily causing grievous hurt. So 118 basically causing grievous hurt or hurt by dangerous weapon. So by dangerous weapon. So the question can be asked, what is dangerous weapon? So any weapon that is used in shooting, like example firearm, stabbing, like example knife, or any weapon that can endanger life, that can be dangerous weapon. So all this can be asked in your upcoming exam. So try to memorize this. Okay. Now look at this. You let me know, is this dangerous weapon or simple weapon? Look at this and tell me. So this is dummy gun, firearm gun, which can lead to entry wound or exit wound. As you know, any firearm injury definitely leads to shock and hemorrhage, bleeding and death. My question is, firearm, is it dangerous weapon or not a dangerous weapon? Yes, Abhinay, Srinivas, definitely dangerous. Now look at this. This is plastic bat. Plastic bat, not the wooden bat. Plastic bat. Is it dangerous weapon or a simple weapon? Okay, just tell me. This is lightweight plastic, basically used by the kids. My question, is it dangerous weapon or not a dangerous weapon? This is basically a weapon, not a dangerous weapon. Yes, good. Now look at this. So this is screwdriver. Screwdriver. You tell me, is it dangerous weapon or simple weapon? Screwdriver. Yes, so it can lead to stab wound, it can lead to head injury. So screwdriver, hammer, so stone can be dangerous weapon, as you know. Okay. So that completes your first question. The second question. Look at the second question. In India, the minimum legal age for consenting for MTP. So medical termination of pregnancy, we call it as legal abortion. So abortion now it is legal, applicable to married, unmarried female. So even unmarried female can go to hospital, he can ask for legal abortion. No need of any consent from the partner, no need of any consent from the parents or relatives. When age is more than 18. Okay, so answer is 18. So 18 is the correct answer. So 16 year, no. 16. 20 years, no. 24, no. Basically 18. Now here, so one important question asked is, up to 20 weeks, opinion of how many doctors needed? 21 to 24, how many doctors? More than 24 weeks, very commonly asked. So up to 20 weeks, 21 to 24, beyond 24. So the most common indication up to 20 weeks is contraceptive failure. Contraceptive failure. 21 to 24, the common indications are when it is caused by rape, when pregnancy caused by rape, when pregnancy caused by incest, the sexual intercourse between relatives, or a blood relative, like example cousin, brother and sister, incest. Disabled woman or minor woman, so less than 18. So all these are indications for MTP up to 21 to 24. So beyond 24, only one indication is there. One is congenital malformation, like example NTD, neural tube defects. Okay, congenital malformation. So it can be anything. So my question is, up to 20 weeks, how many doctors and all, right? Yes, sir. Okay. Okay. So up to 20 weeks, one doctor or one RMP. 21 to 24, 2 RMP. Beyond 24, state level medical board. State level medical board. So in any case of abortion, the gestational age more than 24 weeks, they need to constitute medical board. Consist of gynecologist, pediatrician, social worker. So that is beyond 24 weeks. So one more point to remember, in emergency, when there is a serious threat to the mother health, you can do MTP at any time, at any place, in emergency. So that's why MTP Act is very liberal act. It is basically to protect lives of the pregnant female. So as you know, criminal abortion, there are so many complications, vasovagal inhibition, sudden death, bleeding, perforation and all. Basically it is to legalize abortion. Okay, so good. So this is very commonly asked in your exam. Now my question is, whose consent is needed? Whose consent is needed when age less than 18 years? And one more point, what is your duty when victim age less than 18 years? Come on. What is your duty basically? So when it is less than 18 years, it should be from the parents, father, mother, okay, or the guardian. So loco parentis basically, okay, loco parentis. Say example, when girl is orphan, then they need to take permission from the warden. Okay, warden, like that. And also you need to inform police. Inform police. This is one very important concept. So as you know, when age less than 18 years, there is something known as statutory rape. So even with the consent of the female, the girl, when girl is less than 18 years, it amounts to statutory rape. That is also MCQ. So what is statutory rape? That is less than 18 years. When age less than 18 years, with or without consent. Now I have one more question for you. So that is basically related to the rape. So example, husband and wife. Husband and wife. And wife. Husband and wife. So as you know, they are married, husband and wife, as per some culture. So husband age is, say example, 25 and wife age is 17. 17. Now my question is, say wife, if she complains that is about the rape, is it punishable or not punishable? Is it rape or not a rape? If she complains in police station, or her parents complains in police station, is it rape or not a rape? Come on guys, this is a very interesting question. Shivam Sharma. Yes, so it is punishable. That means having intercourse with wife when wife age less than 18 years, when the complaint is registered within 1 year of occurrence of the offense, that is rape or sexual intercourse, then it is punishable. Okay, within 1 year. So it is stated by Honorable Supreme Court. Okay, so this is very, very important concept. Good. Then also the question can be asked about POCSO. What is POCSO? P for, that is protection of children from sexual offences. Again, question can be asked, what is penetrative sexual assault? What is aggravated penetrative sexual assault? PSA, APSA, SA, ASA, SH. So after the class, just go through the 5 definitions of POCSO Act: PSA, APSA, SA, and ASA and SH. Very commonly asked. Okay, so time being, so we will limit ourselves for the question and answer. Okay, yes, that's okay. This is what we discussed. So more than 20 weeks, 1 doctor. Up to 20 weeks, 1 doctor. Beyond 20 weeks, that is 2 doctor. Beyond 24 weeks, medical board. Whose consent is required? Mother consent is required. Okay? Yes. Good. Yes. So next question. Next question, almost a similar type of scenario. A 40-year-old comes with her daughter to hospital with a recent history of rape offense. Mother is claiming her daughter to be less than 18 years. So mother is telling the age less than 18 years. But doctor does not agree. Okay. Which X-ray used to prove age more than 18 years? Which X-ray? When there is a question of 18 years, what is the best X-ray? We have shoulder joint, elbow joint, knee joint. wrist joint, pelvic joint, है ना? So there are so many important joints, medico-legal important. What is that basically? Sternum? No. So middle end of clavicle and sternum is not commonly used. So in my experience, it is basically shoulder joint, elbow and the wrist joint, sometimes knee joint, and also very important is the pelvic joint. So it is not the answer. Clavicle and skull. So skull can determine the age, but only after the age of 30 and 40 like that. Again, it is not accurate method. Sternum, already it is not the answer. So the best answer is wrist joint. Wrist is the correct answer. So you need to look for whether there is a fusion of the radius or ulna. If radius and ulna fused, usually more than 18 years. So we discussed in detail about X-ray examination. So in previous classes, you just go through that. Okay. Now look at this. Okay. Now question can be asked. Look at this. This is now the same scenario. So look at this X-ray and let me know what is the age probably. So what we can see here. So this is radius and this is ulna. Ulna. And what we can see here. So this is physiform. Physiform. So all the carpal bones are appeared and radius is fused. Ulna is also fused. You can see there is no gap. So there is no gap between the epiphysis and diaphysis or metaphysis. So it's completely fused. We call it as completely fused. So my question is very simple. So when it is fused, what is the answer? Physiform is also there. Physiform is also there. What you can see here, scaphoid, another bone, its overlapping is there. So, but all the carpal bones, when physiform is there, double density you can see there. Whenever you see double dhamaka, so that means it is physiform. Physiform is appeared. Okay. So physiform usually appears in 11 to 12 years. But radius and ulna, that fuses at the age of 18 years. In general, 18 years. So what is the age probably? So 18 to 19 year. Yes, good. So answer is 18 to 19 year. That's nice. Okay, next question. The fourth question. In a suspected case of poisoning, gastric lavage is done. So as you know, gastric pumping or gastric lavage is done. Combined with silver nitrate solution. So silver nitrate give rise to black color. So very simple fact based question. So cocaine, opium, organophosphorus, alphos. Alphos. Try to answer. See, organophosphorus poisoning. No, it is not the answer. So basically fact based question. It is basically alphos poison, that is aluminum phosphide poison. Aluminum phosphide poison. So as you know, aluminum phosphide, it is used as an insecticide, used as a grain preservative. It's very fatal. Why? Because it inhibits electron transport chain. So phosphide, that inhibits electron transport chain. So that causes sudden death. Sudden death. So very dangerous. Alphos poison. Organophosphorus poison, as you know, it is insecticide. The drug that is used is atropine, not the answer. Opium poison. So patient presents with the meiotic pupil, coma, respiratory distress, not the answer. Cocaine poison. So normally presents with the euphoria, rush and crush phase, basically. So the best answer here, that is alphos poison. Fact based question. You need to memorize, nothing else. Look at this. So look at this very important image. All these are basically aluminum phosphide. You must have seen. So those who are from some rural background, you must have seen these pellets. looks like a paracetamol tablet. So these are basically grain preservative. They cause death of the rats, death of the insects basically. Now, can anyone tell me what is the fatal dosage of this aluminum phosphide? What is the fatal dosage? Come on, try. How many? How many can lead to death? Chandana D. So 1, 2, 3, 4, 5 are there. What is the fatal dosage of aluminum phosphide? So it's very minimal. That means one pellet can lead to death. So one can lead to death. Very little amount can lead to death. Okay. So this is one is enough. One is enough to cause death. Fine. So next question, look at the INI CET question. So most of the questions are from standard concepts. So that we discuss in usual forensic medicine class. Okay, so all these are answerable. Okay, so what you can notice here, all these questions are answerable. Out of 10, at least 7, 8 are answerable directly. And definitely there will be some bouncers in INI CET exam. One of the most difficult exam in India, that is INI CET. Because seats are very less, the competition is very high. Okay. Yes, Madhusudan Vinay. So, are you getting some confidence in INI CET exam? Yes. Are you getting some confidence? Okay. Say yes or no. So, lead. So, as you know, lead basically metallic irritant, right? So, what you can see here, metallic irritant. So, AEC. Croton. Croton is organic irritant. So, that is B. Opium. Opium basically CNS depressant. That is D. Cocaine deliriant. So this is the answer. So very simple it is. So this is from classification of poisons in toxicology. So they are classified into organic irritant, inorganic irritant, metallic irritant, okay, non-metallic irritant, animal organic irritant, like example snakes, animal organic irritant, insecticides like OP poison, cardiac poison, like example aconite. So this is taken from that concept, right? So answer is basically okay. First to answer, okay. Okay, first answer is from Aishwarya Baligar. Okay, before that, Dhananjay. Okay, Mohammad Ansari. Yeah, Mohammad Ansari. Good answer. Ansari. That's great. So these are basically Croton tiglium seeds. So they are organic irritant. They are non-shiny seeds. And can anyone tell me? So my favorite question in any of the toxicology class, that is red color compound. So the mnemonic is, or how you can remember old movie Om Shanti Om. My favorite movie in my college days, my days. Okay, so my favorite actress as well, Deepika Padukone. एक चुटकी सिंदूर की कीमत तुम क्या जानो, Ramesh Babu. How beautiful it is. My question is, what is this basically red color compound in toxicology? Yes, come on. Yes, so many answered. Many said, sir, it is mercury sulfide. That is also correct. Lead tetroxide is also correct. Okay, lead tetroxide or mercury sulfide. Okay, so that's great. Have you seen this movie? Madhusudan, Srinivas, Dhananjay, आपने देखा होगा है ना? Very nice movie, very nice. Mohammad Ansari. So some interesting lines, interesting dialogues are needed in every class so that you can keep yourself awake and myself awake. है ना? So forensic is never boring. For me, I love forensic medicine. I like forensic medicine. So I live with the forensic medicine because of my interest in the subject. Not seen Mohammed. So my simple advice, all of you guys, you can take any branch. Anatomy, physio, pharmacology, medicine, surgery, any branch you can take. But by choice. By choice it important. Not by chance. Not by chance. So choice होना चाहिए. By choice कभी मत लेना. ठीक है ना? Madhusudan, do you agree with me? Anything in your life, you must take by choice, not by chance. If you take the subject by chance, you will definitely fail. Okay, this is what I believe in that. I believe, and anyway, every branch has advantages, disadvantages. It is not like that. So I'm doing forensic, great or not great. So someone is doing medicine, great or not great. It all depends on your interest. Okay. How many of you agree with me? Yes, guys. So this is okay. So we completed around 5 questions. Now 6th question. Factory worker in thermometer industry. So whenever word thermometer, BP apparatus, mercury. So mercury common question है exam में. So बार बार आता है. So came with the pink lesions. So pink lesions, acrodynia. So we call it as acrodynia. So acro means periphery. So dynia means pain. Acrodynia, minimata disease, mercurial lentis, erythism. So many questions that can be asked from mercury. So mercury is favorite of any INI CET NEET PG exam. So which of the following is seen? Neuropathy. Yes, neuropathy can be seen. So neuropathy, peripheral neuropathy can be seen in various heavy metal conditions. Basophilic stippling. So that is basically in case of lead poison. Mesaline arsenic poison. Mad Hatters, okay. A and D both are correct. But the best answer is Mad Hatter's disease. So the answer is A. So that is the best answer. So try to memorize Mad Hatter's disease. So now it is uncommon. Those days, so in hat industry, the worker working in hat industry, they used to mix mercury along with the animal skin. So while mixing this mercury along with the animal skin, there used to be vapors, mercury vapors, they used to inhale. Mercury vapor inhalation. That used to cause encephalopathy, that used to cause many complications. That's why the name is kept Mad Hatter's disease. So mad means psychosis. Psychosis. So Hatter means hat industry, animal skin and mercury. You can remember like that. So the answer is A. So this is, try to memorize this, something funny. So hat and Mad Hatter's disease. So it is because of erythism, psychological abnormalities that is seen in mercury poisoning. There will be extreme shyness, so there can be hallucination, there can be delusions, there can be difficulty in concentration, so other neurological and psychological problems. So collectively known as erythism, and it is also known as Mad Hatter's disease because of accumulation of mercury in the basal ganglia and other centers. So there will be tremors like this. Tremors. Okay. So this is how you can remember. So all of you write in the chat box, mercury is equal to Mad Hatter. Also known as pink disease. Also known as Minimata disease. Okay. Also known as erythism. So all these are very commonly as one-liners. So try to write all this. Mercury is equal to all this. Just write in the chat box. So one time writing is equal to 10 time reading. Okay. So I believe in the concept. One time writing in a paper, so is equal to 10 time reading. So you can do that. So while preparing for any exam, you just take the rough sheets and keep on writing few points. And difficult topics you can just note down and you can revise at least 2 or 3 times. Yes, good. Now look at this very important image-based question. This is a case of arsenic poison. So in arsenic poison, there is a inhibition of alpha ketoglutarate dehydrogenase and pyruvate dehydrogenase. So there will be disturbance in energy formation. So what you can see here, lines are there. So these lines are known as Mies line. These lines also can be seen in arsenic and also in thallium. This is INI CET question. So what are two conditions of Mies line? एक होगा arsenic, दूसरा है thallium poison. So in thallium poison, you will see hair loss, neuropathy, Mies line, and cranial palsies. So thallium is one of the ideal homicidal agent. It is known as poisonous poison. So one more important MCQ, thallium is equal to poisonous poison. So keep writing this point, poisonous poison. So what are clinical feature? I'll repeat again, hair loss, so partial or complete alopecia. There can be cranial nerve palsies including facial now. So there can be Mies line. So neuropathy, pain and all very common. Thallium. Thallium is equal to. So Javed, the date is somewhere, I'll let you know. It is shortly only. So marathon session will be there. So I'll let you know. Javed. Javed, how is the preparation? Javed, how is the preparation going on? Then, so this is one bouncer asked in recent exam. So I already stated there are some bouncers in INI CET exam. There will be one or two difficult questions. Medical data security. See, we do interact with the patient. So we do get patient details. So patient details, patient Aadhaar card number or patient, all the details we will get. So we need to maintain this very confidential. So that comes under, what is that act or the law? HIPAA, DPDP, PCPNDT, TOTA. See, TOTA basically for organ transplantation. So Transplantation of Human Organ and Tissues Act. PCPNDT for sex determination. DPDP and HIPAA both are basically related to medical data security. So one which is implemented in India, that is DPDP Act. DPDP Act. So answer is B. So what is that DPDP? Digital Personal Data Protection. The digital. D for digital. Personal. So personal details of the patient. So name, age, all the details, mobile number, everything we do get now. And Protection Act, Data Protection Act, you need to preserve confidentially. Okay, yes, so this is what very commonly asked. Simple. Again, it is not very commonly asked. It is not that related to forensic medicine, but anyway, just try to memorize Digital Personal Data Protection Act, DPDP Act. Okay. Then next question, as usual, INI CET exam, cyanide poison, बार पूछते हैं लोग, cyanide poison and carbon monoxide, both are very important because they act on electron transport chain and they cause sudden death. So in my experience, I have seen many cases of cyanide, many cases of carbon monoxide poison. Carbon monoxide poison, you know, carbon monoxide, one of the silent killer. So it causes death because it forms carboxyhemoglobin, very dangerous carbon monoxide. So inhalation of carbon monoxide, it becomes carboxyhemoglobin. When there is a carboxyhemoglobin, so there is no transport of oxygen. When there is no oxygen, cells are going to die because of inhibition of electron transport chain. So question is, what is that enzyme inhibited by these two basically? So can anyone answer? Madhusudan and others? NADH dehydrogenase, NADH, succinate dehydrogenase, cytochrome C oxidase reductase, cytochrome C oxidase. So as you know, electron transport chain. So there are 4 complexes. So there are basically 4 complexes. So the complex 1 inhibited by rotenone A, pyridine A. A means 1. Rotenone A, pyridine A. Then 4 inhibited by carbon monoxide, cyanide and hydrogen sulfide. 3 inhibited by BAL. So how to remember BAL? 3 alphabets are there, BAL. 2, that is mevalonate. Mevalonate. This is how you can remember. So with this now it is basically cytochrome C oxidase. Complex 4. D is the correct answer. Let's see now. What are the inhibitors of electron transport chain? Chlorpromazine, rotenone, amobarbital, pyridine A, all is a basically complex 1. 2 basically malonate. Okay, 2 that is malonate. 3 basically BAL, antimycin, naphthoquinone. The 4 basically carbon monoxide, cyanide, azide, hydrogen sulfide. Very, very important. So all of you write in the chat box. Complex 4 is equal to carbon monoxide, cyanide, azide and hydrogen sulfide. Keep writing. Abhina Reddy. So Javed, okay, good, that's great. Madhusudan, so आपको लिखना चाहिए. That's great. चलो. Now, so the answer here is D is the answer. So the first to answer Madhusudan and Abhinay Reddy and Abhinay Reddy. So have you seen this web series, Javed and others? Have you seen this web series? Very very interesting web series. This is basically related to cyanide poisoning, and it is something related to Cyanide Mohan Kumar case. So Cyanide Mohan Kumar, so he was a teacher basically. So he used to have sexual intercourse with many females by telling them or by giving them false promise of marriage. So once they are pregnant, or once after the intercourse, what he used to do, he used to give OC pills. So OC pills filled with the cyanide. So Cyanide Mohan Kumar case. So when you are free, you can just go through in Google. So it is based on that story. Dahad is a web series. Dahad. Okay. So this is basically web series Dahad based on cyanide poisoning. Very interesting. If you're free, you just go through this. Okay. Fine. So next, as usual, question from thermal injuries, rule of 9, Browder formula, Palmer rule, Parkland formula. Very commonly asked. Look at this. Surface area of burn injuries in accidental burn. So burn can be suicidal also, example dowry death. Homicidal also, like example dowry death. Accidental also, like example because of the burn in the kitchen. Okay. So while cooking involving front of chest means 9. Both the upper limb. So one upper limb is equal to 9. So 9 plus 9. Face and the eyebrow. So face is involved. So what would be the best answer? So the face, front of face and back of face. So it is not given front or back. So basically it amounts to 33 to 37. So B is the answer. So very simple it is. This is a rule of 9 given by A.B. Wallace. In case of scattered burn, we use Palmer rule. In children's, we use LB formula. So frequently asked. So next question from firearm injury. So one favorite of examiner. Triad of punctate laceration. So laceration is there, bruise is there, and abrasion. So the shape is punctate shape. So look at this. So this is what the punctate shape. So there are various injuries. The shape is same, punctate. So this is known as Marshall's triad. Marshall triad. So Marshall triad is seen in. So that is the question asked. Firearm injury. Oh, there are two options, firearm. So road traffic accident and blast injury. Okay. So one more option you can write other than this, blunt force trauma. Blunt force trauma. So now you can correct and you can answer. जल्दी बताओ. So all of you just try to remember. So we discussed in many times in our classes air blast injury. So whenever there is a air blast, bomb blast, so there will be primary, secondary, tertiary and quaternary. So all is basically secondary blast injury. So secondary blast injury because of the flying projectiles. Flying projectiles are secondary missiles. When there is a bomb blast, so there will be a movement of the particles. Like example, when say example here, the bomb blast in my classroom, suddenly what happens? Because of the blast, I will also fly, all these objects also will fly, even building also will fly. So that building will act as a secondary projectile that will cause damage to other people surrounding the house. So that is basically known as secondary missile. So basically the answer is blast injuries. So blast injuries. So answer is blast injury, secondary blast injury. Now question comes is, what are the common organs affected in air blast injury? Air blast, underwater blast, solid blast. Solid blast. Solid blast means when the bomb is placed within some solid compartment, like example fridge, like example cooker. So that is known as solid blast. Example, this is the cooker and this is bomb here inside that. So my question is, what are the organs affected in these three? Frequently asked in INI CET. So air blast, basically tympanic membrane, intestine and lung. The most common is tympanic membrane. The most fatal is lung. Underwater blast, if entire body is under the water, then it is tympanic membrane and it can be intestine as well. So basically intestine is the best answer for underwater blast. Solid blast, basically bones. So frequently asked in the exam. Good. So many answering. So that's really nice. That's great. So next question from identification. So you can see in INI CET, there will be one question from each chapter. One from identification, one from sexual offences, two from toxicology, one from legal procedure, one from medical ethics. Like this, it is balanced paper. Balanced paper in INI CET NEET PG exam. So you need to read all the papers, all the chapters to score good mark in INI CET and NEET PG. So this is the trick. So you should be average in all the subjects, starting from anatomy to psychiatry. You must read all the important concepts. You will definitely get average or the rank above the average in general. So look at this. In this, what we can see here, permanent teeth. So it is everywhere 1 to 8. Like this, or like this, like this, or like this basically. And primary teeth A, B, C, D, 1 to 8. Let's see one by one. What is universal method? In universal method, you will see 1 to 32 number. 1 to 32. Whenever you see starting from 1 to 32, that is universal method, one of the common method. In FDA notation, you will see like this. Okay, 1, 2, 3, 4. You will see 1, 1, 1, 2, 1, 3, 2, 1, 2, 2, 2, 3 like this. So 1, 2, 3, 4. So it is not FDI also. In modified FDI, same like FDI. So in modified FDI, you see like this 1, 2, 3, 4. So there are 4 quadrants. So right to left 1, 2, 3, 4. That is continuous clockwise. Basically, that is a FDI. 1, 2, 3, 4 is modified FDI. What is Palmer notation? So best answer is Palmer notation. So B is the best answer. So B is the best answer. Good. Now look at this. Try to answer. Look at this now. This is Palmer already said. Look at this and try to answer. See, it looks like this. Like this. What is this? Just try and just try to correlate. So quadrant 1, quadrant 2, quadrant 3 and quadrant 4. So there are 8 teeth are there. So 1, 2, 3, 4, 5, 8. Right side 8, left side 8, below 8, like that it is. There are 4 quadrant. So this is basically FDI method. 1, 2, 3, 4. So all of you write in the chat box. FDI is equal to clockwise. So clockwise 1, 2, 3, 4. 1, 2, 3, 4. So like this it is. Clockwise. Right, left, left, right, right, left, left, right, right, left, left, right. Continuous it is. That is basically FDI. Simple. Okay. Okay, guys. Have you understood this? Abhinay, Javed, Fauzia, Samin, Fauzia. Okay. Now let's see one more image. Look at this now. This we can see here 1, 2, 3 and 4. So this is modified FDI. Can be difficult to remember. So the most commonly used is universal method. In some countries they use FDI, modified FDI. In some countries they use PAMA notation as well. So basically they are dental formulae. Dental formulae. Yes. Next simple question from MTP. According to Amended MTP Act, opinion of 2 doctors needed in the following gestational age. How many doctors? 2 doctors. 10 to 12, 12 to 20, 21 to 24, 6 to 10. Simple one. Try yourself. 2 doctors. So that means it is C. Easy one. Next a question from snakes. Types of snake. As you know, Elapidae, they are basically neurotoxic. Hemotoxic are basically Viperidae. Myotoxic basically, that is basically sea snakes, right? So following is wrong statement. Vipers are hemotoxic. True. So they cause increased clotting time, increased bleeding time, and they cause DIC and death. Local symptoms are maximum in vipers. So that is true. That's why we do a test known as 20 minutes whole blood clotting test. 20 WCT. Whole blood clotting test. Elapidae are myotoxic. So Elapidae, they are basically neurotoxic. Cobra, common kite, coral, mamba and all, they are basically neurotoxic. So they are neurotoxic. Cobra belong to Elapidae, that is true. Elapidae, they are basically neurotoxic. Hyaluronidase is a common content of snake venom. Yes, so it's very commonly seen in snake venom. Not only hyaluronidase, other enzymes as well, elastase and all. So enzymes are more in viper snake venom, not in the Elapidae. So Elapidae, they cause the release of acetylcholine, presynaptic or postsynaptic inhibition of acetylcholine. So they cause neurotoxicity and death. So they cause death within 2 hours, sometime up to 6 to 12 hours. So the answer is basically B. Good, Vinay and all. Yes. Acha, contemporary is telling sir, my friend is snake. Okay, that's fine. Now you tell me, what is this snake basically that is visible in the picture? Look at this head. Look at the constricted neck. So what you can see here, brown spots. Brown spots, triangular head. Triangular head. You can see pointed tail. Nocturnal habit. Yes, Abhinay. Okay. What is this? Madhusudan. What is this snake? Is it Saskel viper? Russell's viper? Or it is pit viper? Hump nosed viper? So definitely it is viper. It's viper only. Because triangular head. When you see brown spots, it must be Russell viper. Russell viper. So whenever you see 2 or 3 rows of brown spots over the body, it is Russell's viper. When you see diamond shaped area, white wavy line, then it is saw-scaled viper. Okay. One more picture just to make you understand. Look at this. Look at the shape of the head. Like this. So what is the shape of the head? What is the shape of the head in this? So whenever you see triangular head, that is viper. So vipers are hemotoxic. Common snakes are Russell's viper, saw-scaled viper. Okay. So triangular, that's great, triangular. Now look at this. One more very interesting image. These are fangs. Okay, fangs. The fangs are like a needle shape, a curved needle in Russell viper, in saw-scaled viper. The fangs are straight in cobra. So the point is, fangs are curved, long in vipers. Write this in chat box. And 90% of the venom that consists of enzymes, elastase, hyaluronidase, all the powerful enzymes. That's why the local symptoms are maximum in vipers. They are very minimal in common crate. So this is one important concept. Yes, venom consists of enzymes. So that's okay. So contemporary telling, sir, I'm having ophidiophobia. Okay, good. Even I have. Next, very important question. Very important question. The finding in image suggestive of which of the following poisoning? So look at this image. So what you can see here, the white spots, hypopigmented spots, looks like a raindrop in the hand. A raindrop in the hand. So this is known as raindrop pigmentation. RDP, RDF, RDP basically, RDP. So whenever word raindrop pigmentation, your answer should be arsenic. Okay. Whenever word basophilic stippling, anemia, motor neuropathy, that is lead. Minimetastasis, acrodynia, that is mercury. Meast line, neuropathy, cranial palsy, thallium. So the answer is arsenic. Okay. So arsenic resemble like cholera. So arsenic poisoning that causes rice water stool, that resemble like natural disease, cholera. That's why arsenic trioxide is also known as king of all poison, one of the ideal homicidal agent. Okay, cholera. So again, all are very important topics. So after the class, go through what are the features of arsenic poisoning and what are the investigations done, what is the treatment, and what is the medical legal aspects of each. All four are favorite of INI CET exam. So yes, Chaitanya is telling arsenic causes NEET PG 2025 PYQ. Yeah, cholera. That's great. Now, some interesting terminology here. So arsenic is known as king of all poison. So arsenic is known as king of all poison. My question is, which poisoning is known as queen of all poison? Queen. Can anyone tell me? राजा कौन है? आर्सेनिक है. रानी कौन है? मतलब queen. Who is the queen of poisoning in general? Contemporary is telling sir alcohol. नहीं है. No, alcohol नहीं है. Srinivas is telling sir aconite. Very good. Aconite. Okay. King of all kings, Thallium. The great king. Thallium. And all these three, they're examples for ideal homicidal agent. Okay, ideal homicidal agent. Frequently asked. So all of you can you write all these terminologies in chat box? King arsenic, queen aconite, thallium great king. Just write. Keep writing. And arsenic poison treatment is ball. Very commonly asked. Ball, drug of choice. British anti-levisite. In INI CET, one more frequently asked question is, what are the contraindications of ball? What are the contraindications for ball? So ball is contraindicated in iron poison and cadmium poison. Iron and cadmium poison. Ball is contraindicated. INI CET, NEET PG, favorite. Good. Mohammed Ansari. Good. That's great. That's okay. So next question. Cyanide. Cyanide Malika. Cyanide Mohan Kumar. So whenever word cyanide, ideal suicidal, ideal homicidal. It inhibits electron transport chain. Complex 4. It causes cyanohemoglobin. Cyanohemoglobin, histotoxic hypoxia and death. So very small amount can lead to death. Death occurs immediately in cyanide gas. So death occurs in half an hour to 1 hour in cyanide salt basically. Okay. So in my experience, there are many cases of cyanide poisoning. So in one very famous case of cyanide poisoning, do you want to hear? First, let me know if you want to. If you're interested, I am going to explain. Otherwise, I'll just skip. Okay. So, in my experience, long back, around 10, 20, 12 years back, daughter-in-law was killed by the father-in-law. Okay. So, daughter-in-law. So, she was killed by the father-in-law. A very interesting scenario. So, father-in-law was having some issue with the daughter-in-law. So, he was basically anatomy professor. I remember he was anatomy professor. He was having good knowledge of cyanide and other poisoning. He was using his medical knowledge. So, daughter-in-law, she used to take capsules, some iron folic acid capsule or tablets. She used to take some capsule for the medical reason. So, what he did, father-in-law, he mixed capsule, or he replaced the capsule content with the cyanide. And that cyanide capsule was given to her. She died. As you know, cyanide causes death. She died immediately. Then after that, what he did, he dissected entire body. So he was basically an anatomy professor. He dissected entire body into multiple pieces by opening Chaurasia, other book, as you know, Chaurasia. So he dissected entire body. Then he had thrown all the pieces into some forest area. Okay, forest area. And he cleaned entire area with the soap and water. So this is what happened. This is what happened in that particular case. Later he was arrested. Then they used some technique to identify that dissected body piece. Can anyone tell me what was the technique identified to match the DNA of that bone marrow which was found in the forest area with the mother of the victim? Can anyone tell me what is that technique we commonly use? Yes. Yes, good. Chalo. Now here the question is antidotes used in cyanide poisoning. So there are three antidotes. One is amyl nitrate, sodium nitrate, and sodium thiosulfate. Very important. See, amyl nitrate, which is given through inhalational route. Inhalational route. Again asked in your exam. Sodium nitrate, sodium thiosulfate, they are given IV route. So the answer is, so what is the Chaitanya? What is the best answer? So Chaitanya? Yes, Chaitanya, what is the best answer here? The best answer is ABC. Okay, ABC is the correct answer. Again, what is the mechanism? This sodium nitrate produces methemoglobin. Okay, what it will produce? Methemoglobin. So as you know, methemoglobin means Fe3+. So this methemoglobin combines with the cyanide, it forms cyanomethemoglobin. All of you concentrate. Cyanomethemoglobin is unstable compound. That's why it is combined with thiosulfate. So when it is combined with a thiosulfate, it forms water soluble complex. So this is very important concept. Yes. So did you get my point? I'll repeat again. Sodium nitrate causes methemoglobin. Methemoglobin has very high affinity towards cyanide. Cyanomethemoglobin. Cyanomethemoglobin is highly unstable compound. When you combine this with the thiosulfate, it produces water soluble compound. It gets excreted in the urine. So this is what present in the cyanide kit, we call it as. In cyanide kit, we have two important compounds, sodium nitrate, sodium thiosulfate. Both are given IV. Amyl nitrate, which is given in emergency through the inhalational route. Yes, Dhananjay, Chandana. So getting my point? Yeah. 15. That's okay. Now, INICET, very important image-based question. Look at this. Can anyone identify what are these seeds? Abhinay Reddy, Madhusudan. So the seeds are brown in color, kidney shaped, then so only 2 points. The fatal dose is 100 seeds. The fatal compound is hyoscine, hyoscyamine, and atropine. Treatment is physostigmine. So now I think you can identify. There are many clues. Brown color है, kidney shaped है, fatal dose is 75 to 100, fatal, and treatment is physostigmine. It produces 90 manifestation, very commonly asked in INICET. Come on guys, what is this basically? Fauzia and others. So this is basically Datura. So Datura is a deliriant. It resembles like chili seeds. Okay. And one more very important. Vinay MR and Srinivas. Chili seeds cause Hunan hand. Frequently asked in INICET. So chili seeds causes Hunan hand. So all of you write in the chat box. Chili seeds is equal to Hunan hand. Hunan hand is a type of dermatitis caused by chronic chili irritation. So especially in food handlers or the female who is handling all the chili seeds, you will see classical dermatitis. So that dermatitis caused by chili seeds known as Hunan hand, not the human hand, Hunan hand, asked once in the NEET PG exam as well as INICET exam. Okay? So capsaicin, okay, that's great. That's okay. Then next question from INICET. Match the following sexual paraphilia. Sexual paraphilia, sexual perversion, very commonly asked. Rape, sodomy, ketamite, passive agent, active agent, POXO Act, frequently asked. Proteurism. On the one side, proteurism, ionism, necrophilia, active algolagnia. Try all of you guys. So what is proteurism? So proteurism is rubbing against non-consenting person. So this is basically 2. It's very common in crowded places like buses, trains, metro trains and all. Commonly seen in males. The victim is usually female. So rubbing the private parts against the female body part is known as proteurism. It can be indecent assault. So 2. Ionism. Ionism means cross-dressing and feminine behavior. So that is B3. So male wearing female dress, behaving like a female, known as cross-dressing, ionism, or we call it as Okay, that is eonism or cross-dressing. Transvestism. Then necrophilia. Necro means dead. Having intercourse with the dead, or sexual gratification by smell of dead body. So that is basically necrophilia. So let's see. This is 4. Very simple. T4. Active algolegnia, basically sadism, inflicting pain to partner to get sexual arousal. So that is basically 1. So now try to find out. So Chaitanya and others. A, B, 1, 2, 3, 4. What is the best answer? So A2, B3, A2, B3, C4 and D1. So 2 is the answer. So this is the correct answer. Yes, 2. So Chaitanya, very good. Fauzia, Madhusudan, great answer. So sexual paraphilia, very commonly asked. Paraphilia, sexual perversion. Okay. Now identify what is the sexual perversion. So male and female in a train. So what is this? Just try to memorize this. Vinay and others. So it is punishable under various sections of BNS. Proteurism. Good. Now look at this. Wearing female dress and behaving like a female. So what is this? Janana. Janana. So this is basically transvestism. Good. Transvestism. Eonism. So all these are very commonly asked in exam. So try to memorize. Voyeurism. So what is voyeurism? Observing an unsuspecting person naked, disrobing, or engaged in sex. So peeping Tom basically. Peeping Tom is basically voyeurism. Fetichism or fetishism. Non-living objects. Inanimate objects. Like by looking at sari, by looking at some inanimate objects. Fetichism. Exhibitionism, very, very important. Can anyone tell me what are types of exhibitionism? What are types of exhibitionism? Chaitanya, Madhusudan, Abhinay Reddy. Exhibition means showing genitals. Genital exhibition. So by showing genitals, he will get gratification. Abnormal sexual behavior. So normally people don't do that. But here he is abnormal. We call it as sexually perverted. Sexual paraphilia. Can you tell me anyone? Yes, Muhammad Ansari is telling, sir. And Chaitanya is telling, so flashing. Good answer. So it can be flashing. So it can be mooning. It can be streaking. Streaking. That means running naked in public place. Like cricket stadium. Like football stadium. Railway station. Bus stand. Running naked. So he gets some sexual pleasure. So that is what exhibitionism. Proteurism, already we discussed. So proteurism is equal to toucherism. Then masochism, very, very important. Masochism, deriving sexual excitement from being humiliated. Very interesting, humiliation. Or self-defeat. Beaten, bound, otherwise made to suffer. Very important. So self-defeat, humiliation can lead to sexual arousal. That is known as sexual masochism. So very important definition. Then sexual sadism, giving pain to the partner. You can see here, physical suffering, giving pain to the partner, or by seeing the partner in a lot of pain or suffering, he gets the sexual pleasure. Sadism, sadist बोलते हैं ना हम लोग, so sadism. Transvestism already discussed. Pedophilia already you know, that is with the children. So all these are frequently asked. And some people, they have telephone scatologia. Can anyone tell me what is telephone scatologia? Telephone scatologia. Madhusudan, Chaitanya. Telephone scatologia. Telephone means like calling someone unknown number. Okay, like this. Hi, hello, how are you? Where are you? How are you? Then doing some sexual conversation with random person. So calling 100 of number every day. If that side female voice, then he will start doing all sexual conversations. And he gets the sexual pleasure. That is known as telephone scatologia. कुछ समझ में आ रहा है ना? Call धनंजय, धनंजय, मधुसूदन, चंदना. Necrophilia. So necrophilia, having intercourse with the dead. Zoophilia, urophilia, coprophilia, clismaphilia. So all these are terminologies commonly asked. Yes. Okay. Now you need to identify what is this sexual perversion. So here girlfriend and boyfriend. And this girlfriend, whenever she see a tattoo. So tattoo, she gets sexual arousal. So tattoo is an inanimate object. So what is this known as? So tribadism is also PYQ. Yeah, tribadism means tri means three. So three person, maybe husband, wife, and other person. So seeing wife having sexual intercourse with someone, so he gets sexual pleasure. That is not tribadism. Okay. So simple it is. Madhusudan. ये क्या हो सकता है? Tribadism है? नहीं है. Tribadism कहाँ है? Look at this. Girlfriend and boyfriend. No other person here. Girlfriend is getting sexual arousal while looking at the tattoo of the male. Tribadism है? नहीं है. What is this? Tribadism? No. No. है ना? Dhananjay. What is this? Basically, tattoo fetish. Tattoo fetish. So write this in chat box. Female, tattoo, sexual arousal. Tattoo fetish. So write this in chat box. Tattoo fetish. So some are shoe fetish, sari fetish. Okay. Sari. There are many types of fetichism. So one common one is this. Shoe fetish is also common. Okay. Okay, that's great. Chaitanya, no problem. So आपको याद रखना पड़ेगा. Fetishism also commonly asked. Okay, no problem. Chaitanya, that's okay. Madhusudan, लिखो. Is it interesting, guys? Is it interesting? These images. I hope you will grasp more points with the images, instead of as usual traditional PPT reading. है ना? Say yes or no, guys. Chaitanya, others. Okay. Chal. So rapid fire is at the end, last. Next question. A case of poisoning with a 40-year-old female. So female. So probably female depression is very common. So depression is the commonest cause of attempt to suicide. So must be a case of attempt to suicide. Odorless, tasteless powder. Odorless, स्मेल नहीं है, टेस्ट भी नहीं है, टेस्टलेस है, और सलेवेशन है, abdominal पेन है, और पैराप्लीजिया एंड वीकनेस भी है. Patient is having weakness and paraplegia, serum hypokalemia. So there is a hypokalemia. So whenever word hypokalemia in exam, in forensic medicine, so it is not arsenic poison. In arsenic, clinical presentation, rice water stool. Lead poisoning, you will see anemia. Mercury, Mad Hatter's disease. Answer is barium carbonate. Yes, good. So answer is barium carbonate. So barium is equal to hypokalemia. It also causes muscle paralysis. It's basically a rat killer. So a rat killer powder. So our ant killer. Insecticide. So in this case, it was consumed by the female, presented with hypokalemia. Your answer must be barium. The best way, you can rule out the other options. The answer is barium carbonate. Yes, Chaitanya. Mercury is a question. Now I got a question for you. You need to answer, Chaitanya. What is this? This patient, very interesting image. All of you, very interesting image. Mad Hatter. Strawberry tongue. Strawberry tongue. Commonly seen in Kawasaki disease. Glass blower shake. Glass blower shake. Like this. Tremor and ataxia. Tremor bhi hai. Acrodynia. Blue black line. Accumulation of that in the eye. So what is this known as? Very, very important question. Everything is one-liner. Everything in the image is one-liner. So what is this? So this is basically mercury poison. Yes, Chaitanya, are you getting my point? Very important topic, mercury. So mercury deposits in the eye, causes the opacity in the anterior lens capsule. It accumulates in the basal ganglia, that leads to tremors. It causes tremors and all. Mercury is a heavy metal, right? So treatment is chelating agent. Like example, Bal and others, right? So brown malt reflex, Javed, yes. Strawberry tongue, so scarlet fever. So these are all very important INI CET question. Minimata disease, acrodynia, Pink's disease, and remember one more important funda in organic mercury. In organic mercury, Bal is contraindicated. So write this, all of you, especially Chaitanya. So write this in chat box. In organic mercury poison, Bal is contraindicated. So Bal contraindicated in 4 conditions: peanut allergy, iron poisoning, cadmium poison, and organic mercury. So 4 important contraindications for Bal. One is organic mercury. The classical condition is Minimata disease, that is consumption of fish containing of the factory waste, that is ethyl and methyl mercury. Yes, Vinay, Javed, great. That's important. Chalo, this completes this question. Again, all of you concentrate. Danbury tremors. Danbury tremors, like this. Danbury tremors. Basically intentional tremors, like cerebral heart disease. Good. So mercury you can just go through after the class. Then very important concept. Declaration of Oslo by World Medical Association. World Medical Association, WMA. So like IMA we have Indian Medical Association. like that World Doctors Association, that is known as WMA. So there are some declaration by Doctors Association. So the following is Oslo. Oslo means what? Oslo Declaration. Oslo is a place where declaration is done. Options are therapeutic abortion, torture, ethical aspects of medical research, hunger. Yes, Chaitanya is answering great. So Oslo is there. That means abortion. So what we can see here, two O's are there. So Oslo, abortion. Torture, Tokyo. Ethical aspects of medical research, Helsinki. Hunger. So hunger, can anyone answer? Hunger. Chaitanya, Madhusudan, Srinivas. What is the declaration by WMA that whose theme is hunger? Hippocrates, no. Hippocrates is that is basically medical ethics oath, basically. Hunger, basically hunger. Srinivas, Chaitanya, Javed, Tokyo, Torture, Norway नहीं है क्या? Norway भी नहीं है क्या? So what we can see here, Malta. So answer is Malta. So Malta is equal to hunger. So Oslo, abortion. Sydney is definition of death, brainstem death and organ transplantation. I remember like this: Sydney, kidney, organ transplantation. Okay, I remember like this: Sydney, kidney, brain death. So all of you write this in the chat box. Sydney, kidney. Sydney, you know, Australia. Kidney, organ transplantation. Brainstem death. So death, basically. Munich, medicine. Discrimination in medicine. Helsinki, human experimentation. H for Helsinki, human experimentation. Lisbon, rights of patients. Venice, terminal illness. Tokyo, torture. Geneva, Hippocrates. London, medical ethics. Istanbul, again torture. All these are one-liners. INI CET. Good. Okay, guys. This is important. So all of you getting my point? Next. Next is again from last year paper. During autopsy of a fetus. So fetus. Which of the following cavity is opened first? The very important question in fetal autopsy is live birth or stillbirth? Live birth or stillbirth? In live birth, there will be respiration. Once there is a respiration, the level of diaphragm is lower, right? So to check the level of diaphragm is important. So level of diaphragm. So as you know, diaphragm is supplied by phrenic now, and the level of diaphragm is very important to rule out stillbirth and live birth. So what is the best answer then? So during autopsy, which is opening of cavities? So first you can open, as usual, head you can open, right? That is okay. After that, is it pelvic cavity or abdominal cavity? So which cavity first? Is it thoracic cavity or abdominal cavity? What is the best answer here? Madhusudan is telling ABCD. Abdominal cavity? Yes. So answer is A is the correct answer. A first. Then thoracic cavity, then other cavities, neck, whatever. So in case of hanging, neck is open at last. This is how you can remember. So answer best is abdominal cavity. Good. Features of Korsakoff psychosis. Again, alcohol. Alcohol is a favorite question. So legal limit of alcohol 30 milligram percentage. Alcohol is a CNS depressant. So there are 3 stages of alcohol intoxication. Okay. So 30 milligram percentage. So chronic alcohol intake can lead to Wernicke encephalopathy. Say example, person is taking alcohol every day, like Devdas, taking alcohol every day, almost 10 years, 20 years. So there will be liver cirrhosis. There can be Wernicke encephalopathy, Korsakoff psychosis. So when there is a cessation for about 1 or 2 days or 3 days, then there can be delirium tremens. Delirium tremens. There can be alcoholic hallucinosis. So all these are basically complications of. So can anyone tell me one more syndrome associated with chronic alcohol intake other than these 4? Wernicke, Korsakoff, delirium tremens, and alcoholic hallucinosis. There is one more syndrome which is associated with alcohol, in which you will see sandwich appearance. Sandwich appearance. Good. चलो जल्दी बताओ. Chaitanya, Chandana, Fauzia. I'm asking you a question. Sandwich appearance of, that is in alcohol, chronic alcohol intake. Sandwich. No, that is beer drinking. That is beer drinking. You just let me know. Ha, very good. Srinivas is getting the point. Marchia-Fava-Bignami syndrome. Good answer. Marchia-Fava Bignami syndrome. Good. So now here question is features of Korsakoff psychosis. So what happens in alcohol? There will be vitamin B1 deficiency, thiamine deficiency. So thiamine is very important for myelination. So when myelination is affected, so there can be ophthalmoplegia. So okay, compensatory confabulation. Okay, features. Okay, what is the best answer? Can anyone tell me? Binge drinking. That's okay. So basically here confabulation is very common. But this is so definitely that there will be confabulation. Amnesia, global confusion, ophthalmoplegia, they are features of Wernicke encephalopathy. So Wernicke encephalopathy. So features in Korsakoff, amnesia also, yes, amnesia also will be there. And A and C, yes, A and C, not A, B, C, that is also correct. Okay. So again, there is a overlapping syndrome. So what we can remember, this we can remember. So in case of Korsakoff psychosis, so there will be features of Wernicke encephalopathy. So there will be Wernicke encephalopathy, global confusion, ophthalmoplegia, and ataxia. There can be amnesia, memory impairment, antegrade and retrograde amnesia, and confabulation. Confabulation. So this is Korsakoff syndrome. Korsakoff syndrome. So try to memorize. This is very, very important concept. And in case of Wernicke, you will see mental confusion, oculomotor neuropalsy, ataxia. The mnemonic is GOA. So GOA, alcohol GOA. So G for global confusion, O for ophthalmoplegia, A for ataxia. So that is what given here. So altered mental status, that is global confusion, that is ophthalmoplegia, that is basically oculomotor now, oculomotor abnormalities, nystagmus and all. Then cerebellar dysfunction, that is known as ataxia. GOA is a mnemonic, very, very important mnemonic, old mnemonic since many years, since almost 20 years, 20, 30 years. So all of you write in the chat box. Now you try to answer what is the best answer for this. Best answer. Amnesia definitely seen. Confabulation seen. AC is there. Ophthalmoplegia also can be seen. BCD or ACD. Anyway, so this question can be framed in different way. Try to memorize. So there is a overlapping symptoms of Wernicke and Korsakoff psychosis. So you can rule out the option in exam. So this is, you can leave time being. So also you can write, so alcohol, and in alcohol poisoning, so there will be global confusion, ophthalmoplegia, ataxia. That's okay. Now this is very important question. Very, very important question. Injury over skull showing inner table beveling. So inner table beveling, cruciate entry wound. The weapon causing it is. So here question is, okay, so example, this is skull. So skull has inner table, outer table. So all of you concentrate. So skull has inner table and outer table. So sometime there can be inner table beveling, that is entry wound. There can be outer table beveling, that is known as exit wound. Exit wound. So gutter wound, that is also caused by the bullet. Okay. So here question is cruciate entry wound. Cruciate, that is basically over the skin, and inner table beveling. Whenever word inner table beveling, so your answer must be, that is firearm injury. So answer is bullet. So hammer causes depressed fracture. Known as signature fracture. Again, INICET question. Hammer has small striking surface and it is a heavy weapon. Caesar and all, that they cause stab wound, incised wound and all. Iron rod can lead to fracture. So the best answer is D. And also remember, gutter fracture is equal to bullet. So write this in chat box. Keep writing. Yes, Gray's bullet, that is also correct. Again, there are 3 types of gutter fracture. Type 1, type 2 and type 3. So don't worry about it. So basically gutter fracture means that is caused by bullet. Linear fracture is the commonest skull fracture. Point fracture fall from height. Ring fracture fall from height. Point fracture in children's. So hinge fracture, motorcyclist fracture. Linear fracture commonly associated with head injury, blunt force trauma. So skull fracture very commonly asked. So just go through the different fractures. Now here is the image. Now this is a case of murder, and during autopsy examination, what we found, the fracture segment of the skull depressed into the brain matter looks like a signature of the weapon. Looks like a signature. ये क्या हो सकता है? Right. Abhinay and others. So this is basically depressed fracture. Now I have one more question for you. So just for interest sake, now look at this. So this is apple. So this is apple, and this is knife, single edge knife, single edge knife. All of you concentrate. Now what is this is single edge knife and this is apple. What is the shape of the stab wound in case of single edged weapon? Look at this now. Look at this. Very interesting image. What you can see here, stab wound is there, single edge knife. This is blunt end, this is sharp end. So what is the shape? Okay, regular shape, that is okay. Is it triangular shape or diamond shape? Diamond shape. Once again I'll show you. Like this. Like this it is. Like this. Come on guys. Try Madhusudan, Srinivas. Come on. Okay, Chaitanya, are you there? Chaitanya. So when it is single edged and double edged knife. Single edge, it looks like this, triangular. In double edged, it looks like this, diamond shaped. This is very, very important concept. Okay, spindle shape. Srinivas is telling, Chandana is answering, that's great. That's fine. That's great. Okay. Then. Now I have one more important picture. Concentrate all of you. This is a case of again murder. And it's a case of near shot. You know, there are different types of shot. Contact shot, close shot, near shot, distant shot. So there is an entry wound is here, surrounded by small entry wound like this. What is this classical feature known as? Image based question. You need to answer. Mohammad Ansari, yes. So this is tattooing. So tattooing is caused by unburnt gunpowder. And this is entry wound that is caused by the bullet. So this is classical bullet injury surrounded by superficial epithelial wounds. Classical of tattooing, this is near shot. Near shot. That's okay. Then next, the last question, all of you guys. After that, there will be rapid fire. Following crystals are seen in the following poisoning. Okay, what crystals basically in exam that is given? Colorless, bipyramid shaped crystals of calcium oxalate. So the image was given, and like this crystals are seen. So question is, what is the poisoning? Ethylene glycol, methyl alcohol, aconite, OP poison. So OP poison presents with the features, you know, features of muscarinic and nicotinic symptoms. Aconite, no crystals, nothing. So either methyl alcohol or ethylene glycol. What is the best answer? So the best answer is that is A is the answer. And this ethylene glycol is an alcohol. It is normally used as a coolant in the vehicles. So ingestion of this can lead to coma, loss of consciousness, like features of drunkenness. And in urine, you will get calcium oxalate crystals. Okay. The treatment is fomepizole. Again, asked in your exam. Fomepizole. So, fomepizole used in two conditions. One is ethylene glycol. The second one is methyl alcohol. Yes, good. Engine coolant basically. This is about the question number 22. Now, immediate question. So let's take a 5 minutes break, guys. I'll have some water and I'll start. So 5 minutes break. Rapid fire. Yes, okay. Now, Dhananjay, am I audible now? Am I audible? Okay, so now some image-based questions that is frequently asked in your INI CET exam. So the first question, there are 10 questions are there. So this is first question. Look at this. This is a case of a poisoning. During autopsy examination, there is a finding here. And what is this finding? What is this finding? You need to identify. Try yourself. So this is a case of certain poisoning. So normal color is purple color, purplish red or bluish purple. The collection of blood in the dependent areas, postmortem staining, and it is fixed. So this is okay. So this is cherry red postmortem hypostasis. Seen in carbon monoxide poison. But here, what is this basically? What is this one? I think many they answered correctly. What is this one? Which is just the compressed area, or we call it as pressure area. Madhusudan, blanching nahi hai. Blanching nahi hai. So this is known as contact flattening. Or contact pallor, which is feature of postmortem hypostasis, or there is no postmortem hypostasis at the pressure area. So it occurs only in the non-pressure area at the dependent area. So this is postmortem hypostasis of carbon monoxide poisoning. So that is what answer wanted. So I think nobody has answered. Only few answered. That's great. The second question. The second question. He is a very famous king. He was killed by colorless, odorless, tasteless powder, whitish powder by his servant. So he is very famous king. He was killed by his own servant by mixing a poison with his food and drink. He died due to gastric carcinoma. So my question is, what is the poison that is used and what is the name of the king? Name of the king. Muhammad Ansari answered correctly. So his name is Napoleon Bonaparte. Napoleon Bonaparte. The poison is arsenic trioxide. Our treatment is BAL. Yes. Third question. The third question. This is a postmortem finding in eye. When eyes are open, there is a deposition of dust particle or the dust particle because of the dryness. What you can see here, triangular patch on the both the side. What is this known as? After how many hours it is going to appear? After how many hours? So this is basically Tachynoria sclerotica. 3 to 4 hours. So normal color is brown or black, or it can be yellow also. It is seen only when eyes are open. So when eyes are open, so either because of rigor mortis or because of cadaveric spasm as well. So it is 3 to 4 hours. Good. Good answer. So many answered. That's great. Now, very interesting poison from toxicology, asked once in INI CET exam. So this is a button firecracker. So what is this firecracker consist of? Inhalation of this can lead to encephalopathy, can lead to some serious complications. What is this basically? This is known as Diwali poison. Diwali poison. So basically, phosphorus, yellow phosphorus. So there are two types of phosphorus, yellow and red phosphorus. Yellow phosphorus is very poisonous. So it can lead to acute liver atrophy. So Diwali poison is basically phosphorus, or it can be some traces of mercury as well. So Diwali poison, yellow phosphorus. No, ये oil of vitriolite नहीं है. क्या? Good. Then look at this. So this is X-ray of the wrist joint. All the carpal bones are appeared. Radius is appeared and fused. Ulna is appeared and fused. And the lower end of first metacarpal also appeared and fused. My question is, what is the age of this person? So good. So good, many answered. So more than 18 years. What is the medico-legal importance of 18 years? What is the medico-legal importance of 18 years? You need to mention few points. What is medico-legal importance? And also try to remember, there are 8 carpal bones, proximal and distal. The mnemonic is, she looks too pretty, try to catch her. Scaphoid is a boat-shaped carpal bone, MCQ. Most common undergo fracture is scaphoid. The biggest is capitate. Hamate has a hook. So physiform is P-shaped, smallest one, 11 to 12 years. So many questions can be asked. So very good. So one is consent, very good voting. Consent. So consent for surgery. Consents for sexual intercourse. That's okay. Then, so major, marriage, abortion, organ transplantation, will. So you can make valid will. So we call it as testamentary capacity. So all these are basically, so Vinay, that is in males 21, females. So marriage in females. So marriage in females. Good. That's okay. Then the 6th question, image based question. So this is very common plant. It is found everywhere in all parts of India, especially waste places. What we can see here, spiny projections, and they are in clusters. So identify what is this. Identify and MLI. So whenever you see fruits in clusters, it must be castor. Castor, resinous. The active principle is resin, which inhibits protein synthesis. It inhibits RNA polymerase. It can lead to hemorrhage in brain, kidney, and liver. It's an organic irritant. So it's an organic poison basically. So MLI, so it can be used in homicide, rarely suicidal, and accidental poison. The fatal dose 10 seeds, fatal period 3 to 4 days. So very famous case is umbrella murder case. So umbrella murder case is one very important case of resinous communist poisoning, where a journalist, he was killed by using resin pellet embedded in the tip of the umbrella. He died after 3 days. Very famous case, umbrella murder case. So try to memorize this, Dhananjay and others. This is the 6th one. Then we have a snake, very big snake, no spectacle mark. It has a tendency to eat. It has a habit of eating small snakes. What is the scientific name of this? And what is the type of venom it is producing? What is the scientific name? And what type of venom is this? So it is not Naza. Naza is common cobra. So this is big king cobra. What is the scientific name? King cobra, you are right. Scientific name. Yes, many answered correctly. So this is Ophiophagus hanna. This is neurotoxic. Okay, good. Dhananjay, so great answer. Now I have one more picture here, very commonly asked INI CET question. So what you can see here, flower, yellow color flower. What you can see here, mustard seeds and seeds of this plant. So adulteration of these seeds with the mustard seed can lead to a poisoning and can lead to some clinical condition. What is the clinical condition and what is the name of this plant? It is not datura. Very important in INI CET. So these are mustard seed. These are poisonous seeds. And this is pricky poppy. Pricky poppy. Poppy means opium. Pricky poppy. Now it is not kesari dal. So kesari dal, that is Lathyrus sativus. Beta oxalyl aminoalanine, that is basically latheriasis. But this is different condition. So presents with ascites, edema, glaucoma, heart failure and all. What is this? Try. Yes, Madhusudan got the answer. So Madhusudan and others got the answer. So also before that, Madhusudan, Datura. Okay. The first to get the answer is Madhusudan. So this is the Argimona mexicana. And it leads to a condition known as epidemic dropsy. So this is very, very important. Okay. Epidemic dropsy. Endemic ascites caused by pyrazolidine. Neurolethriasis caused by Lathyrus sativa. Beta oxalyl aminoalanine. Very important. Then the 9th question. This is one very important question asked in INI CET. He is very famous personality. He was suffering from psychosis, psychotic condition, delusions. He was having delusion of persecution. So he killed the president of UK under the influence of delusion of persecution. So this is basically criminal responsibility of insane. Criminal responsibility of insane. So what is this rule known as? What is the BNS section for that? So what is the BNS section? And what is this rule known as? You are suffering from delusion. Patient basically. Insanity defense, getting away with the murder. Case of murder, he got away because of his insanity. ये क्या हो सकता है? 117 नहीं, धनंजय नहीं, रिया गोयल नहीं. BNS section. So this is McNaughton, you are right. And this is 22 BNS. So all of you write in the chat box. So 22 BNS is equal to McNaughton rule. 22 BNS is equal to McNaughton rule. That is equal to 84 IPC. Keep writing this. And the last question. This is very important question. Just to finish the class with smile on your face. Very old movie. What is this condition? Ramo, Ramanujam, and onion. So what is the name given to this? What is the medical name given to this? Can anyone tell me? No. So no, guys, no. It is not split personality. Split personality is schizophrenia. This is not schizophrenia. Okay. This is something else. Correct word, Madhusudan. Aparachitudu, yes, that is the name correct. What is this disorder known as? Okay, it is multiple personality, basically. Multiple personalities. So what is the name given to that? That is what I need. Okay. Srinivas answered okay, but that is common word, medical term for that. We call it as something else. I think dissociative identity disorder. Good. So this is basically dissociative identity disorder. I think only one student answered. Madhusudan. So Madhusudan, good. So Madhusudan, great answer. So after the class, I just go through this. What are these multiple personalities? So whether the personality is aware of other personalities. What are types of dissociative identity disorders? So treatment and interesting facts also commonly asked. Okay. So just try to remember it is multiple personality. The split personality is schizophrenia. So all of you write in the chat box. Schizo is equal to split personality. Okay. This is what you need to write. Split in the thought. That is basically schizophrenia. So that is a disorder of thought process. Okay, good. Great answer. So this completes your all 10 image-based questions. So thank you all. So especially those who are preparing for INI CET, I hope you got some idea how they're asking questions and how you need to prepare. I know. Yes, no, guys. Getting my point? INI CET, there are few concepts. There are few commonly asked concepts that you need to go through. So after going through PYQs, you will come to know which is important, which is not important, how they're asking question and all. So there will be various type of questions like image-based question, match the following, sometime reasoning questions as well. So I hope you got all the stuff, some orientation. Yes or no? Srinivas, Madhusudan, Abhina Reddy. So if you get seat in AIMS or any AIMS in India, so we will have party there itself. I'll come there. So I'll just meet you, okay? So some 2 or 3 years back, so I promised one student, if you get seat in AIMS Delhi, I will meet you definitely like that. And that boy, he got seat there, and he called me, sir, you just come to AIMS Delhi. So during my some class schedule, I went there to AIMS and I met him. Had a very nice time there. Okay. So hope you will also get seat in INI CET AIMS Delhi. So dream actually. So okay, Madhusudan, Dhananjay, Srinivas, Vinay. Yes, Vinay. Thank you all. So wish you all the best for upcoming exam. So I completed some most important topics in last 2.5 hours. So there are some image-based questions. There are some important facts, some important concepts. So around 20-30 concepts we discussed. So there are many concepts so that you need to go through after the class. Yes, guys. Thank you all. See you next class.